Cartilage, you must know why it is decreasing. The size of the cartilage decreases according to the wear and tear of the joint. The cartilage is nothing but a spacer between two bones in the joint. A spacer in themselves, it is a soft cartilage, it is a soft bone like tissue which supports the movement of the joint, which has a lubricating fluid called a synovial fluid, which helps you to move the joint in simple, painless, soft movement. So, the cartilage is the main part of the joint where the cartilage bears the weight of the body. The cartilage moves the joint in a normal attitude. The cartilage which helps like a shock absorber. That means, when you wear weight on the joint increase in the body's weight, rather hyper or normal activator of the joint will take over by the cartilage for a smooth activity. When this cartilage goes for a wear and tear during your progressive life like a shock absorber in the vehicle, that means there is a possibility that the wear and tear of the joint will happen because of the movement of the joint and the age of that joint and the certain circumstances like obesity, where the weight of the body is increasing more than what it needs to be according to the BMI and the height and weight. So, when there is a wear and tear is increasing because of the obesity, because of the previous trivial injuries, because of the sepsis, arthritis, because of various other causes which lead to a damage to the cartilage, will have a more wear and tear compared to a normal human being. So, obviously, after the age of 45, there is a natural degeneration leads to wear and tear of the cartilage, but when there is obesity or when there is a damage to the cartilage and when there is a tumorous conditions or when there is certain diseases like cartilage disease leads to more wear and tear because of its disease process. So, this disease process is affecting the cartilage, will damage the cartilage, and then furthermore, when the cartilage is wear down or weaned down the size of its own by age of 45 to 60, then the hard bones rub each other, pains more, and then form a deformity in the limb. So, the cartilage itself is the main part of the joint where it maintains the smooth activity of your joint, it maintains the shape of the joint, it maintains the stability of the joint, and it maintains the power of the joint. Hence, the cartilage to be maintained in proper manner. It usually a balanced diet is required to maintain the cartilage quality. Apart from that, a good minerals, vitamin D, calcium and protein, fat and carbohydrate. We should have a regular exercise to your joint to maintain the vascularity and to maintain the strength of the ligaments, so that the cartilage will not bear much weight, because the ligaments will support for the weight point of view. So, the cartilage is the most important part of the joint, where the joint to be well maintained, well secured and properly well trained when you do a sports activity. The warm up exercises are most important for the joint and cartilage, so that the untoward trivial injuries or major injuries in the sports activities will not affect the ligaments and the cartilage. So, many aspects in the sports injuries, you see there is a damage to the ligaments as well as the cartilage, like meniscal injuries. So, obviously, you must take care of the cartilage. Stage 1, 2 you can treat with the medicines, physiotherapy and splints. Stage 3, 4 you should need to a surgery where the replacement of cartilage like total knee replacement, or certain furthermore joint replacement is required for the treatment of the cartilage.